Hi, and welcome once again. This is Javier Reyes, ready for a lecture. We are going to continue our discussions on Chapter 7. On our previous episode, we discussed the various equipment that is used in phlebotomy. We touched on the phlebotomy chair, the phlebotomy lab in itself. We talked a little bit about the phlebotomy cart that is used, the supplies that need to be in your phlebotomy cart as you're preparing for the day, and of course, the responsibilities that you have as a phlebotomist. We discussed the several areas of safety regarding the equipment that will be used in phlebotomy and that you are responsible for ultimately. And today we will continue our discussion and one of the more important areas of this chapter, which is the additives, the colors, and what your knowledge has to be for the certification exam. So please stay tuned and we're going to continue our discussion in just a minute. We are on chapter 7 and we are going to start discussing about the evacuated tubes. As you might recall, I did speak about a little bit about the tubes themselves, including the color coding, the expirations dates. I mentioned that these tubes have to be up to date, cannot be expired because of the loss of vacuum to themselves. These tubes are mainly composed of hard plastic, which helps them prevent from breaking. So it's a kind of safety feature. So it is your job, it is your responsibility to know the type of tube that you will be needing to collect a specimen. So when you receive a requisition with a particular lab, you should know which tube you need to select. All right. I also mentioned that these tubes are mainly manufactured by two companies. One of them is called BD, Beckett Dickinson, and the other company is called Evacuate. And the colors are very similar for the most part. The additives that are in the tube or chemicals that are inside the tube, if any, are also the same. All right. So again, let's get into the tubes and go more into depth about them. I do highly recommend or expect that you really obtain this knowledge because a lot of questions on the certification exam have to do with the additives and the order of draw of these tubes. So it is imperative that you have this knowledge very, very firm in your memory. All right. So let's get right to it. We discussed other equipment such as the syringe systems. Okay, there's different kinds that we're going to be using, the sizes and the lengths and the gauges, the needles, including the 21 gauge, which is the most common one. I discussed the different parts of the syringes, including the barrel and the plunger. And I give you a tip about the use of these syringes, which is to break them loose when you first open the package. And before you open the package, make sure that the packages are intact, that they're not wet or open, which will invalidate the sterility. Remember that anything that has contact directly with your blood can potentially present infections to the patient. So it is very, very important that you use sterile equipment when you're going to perform a venipuncture. I discussed the transfer device, which is the safest way to transfer blood from a syringe into an evacuated tube system. However, these are rare, but you will have knowledge about this. Remember, that is the safest way, even if it's not the most common way it's done out there in the field. Remember that every needle has to have a safety feature with it, and you are expected to use a safety feature because the equipment are as good as the employees that use it. When you are going to apply a safety feature, remember to use only one hand, okay? And look at what you're doing. Do not be distracted trying to apply a safety feature without looking, as you may accidentally puncture yourself and place yourself at risk for contact with bloodborne pathogens, which we'll discuss later. So there are various kinds of syringe and transfer systems, but again, the most common ones will be the ones that your provider, your facility has for you. Make sure that you are very knowledgeable in their use. All right, we discussed the winged infusion sets, also known as the butterflies. They come in various gauges or sizes, as you know. Again, we try to keep these limited to their use for very frail veins, the elderly populations, and of course, very young children that have very small veins. You can use these winged infusion sets with the ETS system, which has the tube holder, the multi-sample needle, and of course, your evacuated tubes. But if you need more control of vacuum because of fragile veins or dehydration, then you might opt to choose or use the syringe system where you have more control of the vacuum. I did also mention that you must use at least a 10 ml or 20 ml syringe to withdraw blood from a patient. The smaller the barrel, the higher the vacuum. So refrain from using 5 ml or 3 ml syringes as this itself may cause the veins to collapse. Okay, so again, use 10 or 20 ml syringes to collect your blood specimens along with your transfer device. All right, so be knowledgeable again in the equipment that your facility provides for you and show the competence that you are. Okay, so now we are going to get started in the evacuated tubes, okay, and the chemicals that are in the tube. So it's important for you to remember, you only have two types of tubes, okay? Some of them will have anticoagulant tubes, anticoagulants rather. Anticoagulants are chemicals that prevent blood from forming into a clot, all right? That means the blood is going to stay in the same composition as it is in your body right now, all right? So for some exams, the blood has to be in this state, in your normal state. We call those plasma specimens, all right? Now, and there's other tubes, which we'll talk about in a bit as we continue our discussion, that are coagulation tubes, all right? That means that we need that blood to form a blood clot, okay? So when this happens, all the clotting factors that are in your blood, which form the clot itself, are going to be used up. And as a result, you are going to have a serum specimens, okay? So let's talk about the anticoagulants first, or plasma specimens, okay? So again, anticoagulants are substances that prevent the blood from clotting, okay? As you know, if you have a drop of blood and you put it on a surface, immediately the blood will start to form a blood clot. It's automatic. Imagine if you had a little cut and you would not clot, you would eventually bleed to death, depending on the size of the cut, right? But our bodies are able to form blood clots to slow down and eventually stop the bleeding. That is why we have coagulation factors, okay? However, when we do phlebotomy collections, we need some blood to stay in its normal state. So we have to add something to the tubes called anticoagulants. And there's various types, and we'll discuss one at a time, okay? So again, anticoagulants are substances that prevent blood from clotting, therefore keeping the blood in its normal state, all right? So how do we prevent blood from clotting? Well, there's two ways. One of them is by precipitating calcium. Precipitating means something that clumps up, okay? Calcium, of course, we get it from our nutrition. Calcium is a big clotting factor. It plays a role in the clotting mechanism, a long, complicated process, okay? So this is one of the ways that the chemicals attack calcium and prevent the blood from clotting or forming a blood clot, okay? Therefore resulting in an anticoagulant, okay? So by controlling calcium, okay, you're stopping the formation of thrombin. Thrombin is really the one that forms what we call platelet plug, all right? So imagine yourself have a little puncture in your finger, all right? If you don't apply pressure, you will ooze blood, right, gradually and slowly. But by then, your body has already started the clotting process. It sends clotting factors to go in there and form a platelet plug, right? So in the tubes, we have anticoagulants. In this case, we have one that stops calcium, so it can ultimately stop the formation of thrombin, which is going to form that little blood clot, okay? Now, we're going to discuss 4 different kinds of anticoagulants today, okay? The most common one is called EDTA. It's an abbreviation for ethylene diamine tetraacetic acid, okay? Again, ethylene diamine tetraacetic acid, EDTA. You're going to find this chemical in various tubes, in various colors, all right? And there's different kinds of EDTA, EDTA1, K1, K2, and so on, all right? But don't worry about those. Just know that EDTA is the most common anticoagulant, all right? And it is the culprit, okay, the cause of many cross-contamination, all right? That is why we usually collect EDTA tubes last in the order of draw. So when we get to the order of draw, hopefully you understand EDTA is the last one. Remember, it is an anticoagulant. And if you're going to collect some tubes that need to be clotted, you cannot collect it before then because you will contaminate those tubes. Okay, so EDTA goes at the end. Okay, there's other tubes called, or anticoagulants called citrates. Citrates are usually found in tubes that require coagulation studies. Coagulation studies, all right? The most common one is your light blue. Your light blue has citrate, sodium citrate. This is also an anticoagulant. What does it do? It stops blood from forming into a blood clot, okay? So, for example, if you have a patient that is taking medications to prolong the clotting process, right? We call it thinning the blood, okay? But what it's doing is prolonging the clotting process because we don't want this patient, or the doctor doesn't want the patient to form little blood clots because then they can have a stroke or a heart attack or pulmonary embolism. So the doctor prescribes medication for this person to prolong the clotting process, right? But by the same time, he needs to also monitor this process, okay? The patient cannot be taking these medications without being monitored. So we might have to go out there and collect, right, what we call PT-INR. PT-INR, remember, this is one of the most common tests, right? And sodium citrate is in the light blue, okay? And we'll go more into depth into the specific tubes in a bit. Another one is called heparin. Heparin is a strong anticoagulant, okay? In a previous discussion, we discussed two ways that we can find in nature. And one of them is, of course, in mosquitoes, they have some of this chemical. And of course, leeches, they also have this chemical in them, and it allows them to suck blood from our skin, okay? Oxalates is another anticoagulant. This is not a very common one, but it is in one of the tubes that you'll be using. Therefore, remember, 4 anticoagulants: EDTA, citrates, heparins, and oxalates, okay? Again, anticoagulants prevent blood from forming blood clots. So you need to remember this, all right? Anticoagulant tubes will give you a plasma specimen or sample, all right? We need this type of sample because these tubes contain all the clotting factors. Because there is no blood clots in them, all the clotting factors are still in the tubes, and the lab needs these clotting factors to evaluate and provide results, all right? So I know it's a lot of information, okay, but take it slowly. As I said, I do encourage you highly to make some index cards for yourself, okay? It's on page 184. You'll find the tube, the additive that's in there, the color, and some of the most common tests that are done. You will need to add this to your index card and, of course, commit it to memory, okay? It's very, very important that you know this, okay? Anticoagulant specimens. When you collect an anticoagulant tube, either be a light blue or a lavender or some other kind of anticoagulant, you must mix these immediately, because once the blood gets into the tube and makes contact, it starts to want to form blood clots. So the sooner you mix them, okay, you mix these tubes and you have contact blood with the additive, you prevent the clotting process, okay? If you fail to mix them or invert them immediately, the clotting process begins and you might have a sample that we call hemolyzation, all right? There will be little, very micro blood clots that we cannot see with the eye, but when we centrifuge and we put them in the centrifuge, you're gonna see little specks of red, okay? And that is called hemolysis. It's one of the H words that you have to remember, hemolysis, all right? So mix them, invert them immediately, usually at least 4 times, all right? You can invert them like in this manner, or you can do an infinity movement like this, all right? Like you're forming a number 8, right? Laying down. Gently mixing prevents hemolysis, The number of inversions, like I said, usually four, on average, 4 to 5 inversions would be enough, okay, depending on the manufacturer. So again, remember to mix tubes immediately. So let's take the first anticoagulant tube, okay? Number one, this is called the light blue, the light blue. This is usually the first tube you're going to be collecting all the time, unless you are going to be collecting sterile tubes, right? And we'll get into those in another chapter, okay? Blood cultures would be the first one. But in this case, let's say your light blue is one of the tubes that you're gonna be collecting, and this would be the very first one, okay? All right, so light blue, it's a tube that has, again, sodium citrate, okay? And it requires a 9-to-1 ratio of blood to additive, okay? Why do you have to know that? Because if you collect a light blue and you do not mix it well, number one, you're gonna have hemolysis. Number two, you're going to have an off ratio. You're gonna have less blood to more chemical. So that is going to give you incorrect results. Incorrect results will go to the doctor and he will give incorrect treatment. Incorrect treatment can result in injury to the patient. They may give more medication or less medication. If the doctor increases their dosage, they will increase the chances of this person bleeding, all right, in their head or in their stomach or elsewhere. But if the doctor decreases the dosage, it increases the risk of him developing blood clots. So this is very important that you remember. If you're going to be collecting a light blue tube, you must remember the 9-to-1 ratio. That is critical that you remember. You cannot underfill tubes. You cannot mix two partial tubes and make them into one. That is not correct, okay? If you ever have to, the tube stops or you lose the vein or whatever, you're gonna have to get another tube, all right? And make sure the tube is at least 90% filled. Remember, you remove the tube until it stops on its own, and it must be 90% filled. And you're gonna see a very small arrow, okay? That it points to the line where the tube should be filled at. So remember that, okay? Collect your tube, invert it, okay? Make sure all the chemical comes into contact with the blood. Super important, okay? Vacuate is one of the companies that makes this light blue, okay? And it has, again, sodium citrate and anticoagulant, alrighty? So make sure you remember that. Super, super important. Some special use anticoagulants that you're going to be looking at are acid citrate dextrose. Those are used mainly for sterile collections, such as DNA testing, right? Paternity testing. You also can see citrate phosphate dextrose, another one also used for sterile collections, and sodium polyethanol sulfate. Sodium polyethanol sulfate, or SPS, okay, is used in collection of blood cultures, all right? For someone that has a blood infection and you're ordered to collect blood culture specimens, you will have to use SPS or the blood culture bottles, okay? Again, those will be covered in special collections in other chapters, so we'll go into that later, but they're also part of your anticoagulant additives there in the bottles, okay? All right. So we have other additives that are also considered anticoagulants. We call these anti-glycolytic agents. Anti means against, glyco refers to sugar, okay? So against sugar, okay? These are substances that prevent glycolysis or the breakdown of sugar, okay, by your blood cells. Remember that your blood cells are alive just as you are, and they use sugar just as you're doing right now, okay? So the fact that you're pulling blood into a tube doesn't mean that the cells are dead. They're still working, they're metabolizing the using of sugar, and all the nutrients that are in that blood are being used. However, if your doctor wants to know your fasting glucose level, all right, you must use a special tube that prevents the cells from using up that sugar, okay? These are called anti-glycolytic agents, okay? The only one we use is called sodium fluoride. It kind of sounds like that toothbrush, right? Fluoride, except sodium fluoride. That is the name of the anticoagulant, okay, that is used to preserve sugar in the tube, okay? Again, mainly used to monitor glucose levels. It does preserve the glucose for up to 3 days, and keeps bacteria growth. Okay, it keeps it from growing because bacteria need sugar to grow, to multiply. Okay, so by preventing the use of sugar, okay, you're preventing the growth of bacteria. Okay, it also used with potassium oxalate, okay, in combination for rapid response, so it can we can do the exams faster. Okay, so sodium fluoride and potassium oxalate are sometimes used in combination, okay, for certain tests. All right, now the opposite of anticoagulants are clot activators. Clot activators are chemicals that induce, promote, accelerate the clotting mechanism, okay? So if you add some chemical or substance to increase the coagulation process, that means you want it like quickly, okay? You will need a tube that has a clot activator. Now, there are some tubes that do not have any additives, such as the red top. The red top, again, we discussed it earlier, is called a discard tube, right? But it could also be used for other tests, okay? It does not have anything. However, the tube itself is made of a plastic, okay, of silica. Okay, this silica encourages the coagulation process. As soon as the blood comes into contact with that tube, automatically the blood starts to form little blood clots. All those clotting factors start to form that little plug, and that's exactly what you want, and that's fine because you need a serum sample. Remember, clotting tubes, clotting factors, coagulation tubes yield serum samples. All right. So in some tests, you are going to need, all right, those clotting factors to be used up. Okay. So you'll be collecting a coagulation tube. All right. One of the clotting factors that, of course, is in your blood is thrombin. Okay. And thrombin is used in one of the orange tubes. The orange. This is a orange tube is used for stat exams, right? For example, you're in the emergency room and somebody needs lab work right away, you need results like super fast. The orange top has thrombin in it. It means that if you put blood in that in about 5 minutes, that blood sample will be completely clotted, okay? And you can centrifuge it, separate the red blood cells from the serum, and you can get your samples from that serum right away. You can get probably results within 30 minutes or so, depending how fast it's delivered. But thrombin, again, it's a chemical that is added to these tubes, especially the RST, the rapid serum test, to be able to provide very fast results. Okay, so those are some of the coagulation tubes, right? The red top, the orange, okay, are the most common ones. Okay, and now you're gonna see some tubes that look a little bit different than others. Okay, some of them have a little gel in the bottom. Okay, don't let that scare you or confuse you. Okay, that gel is called thixotropic gel. All it is a separator. Okay, why do we need a gel separator? Well, it helps keep the density or the the thickness, okay, of the cells and the serum or serum plasma separated. Okay, it's going to create a little barrier, right? So we have a machine called the centrifuge. Okay, and I'll show it to you guys. When we put the tubes in there, it spins them really the blood and the serum will stay still separated. Okay, versus the tubes that don't have it, once you invert it, it's going to mix once again, and you're going to make that sample worthless. Okay, you might have to recollect. So we always have to make sure that our non-gel separated tubes are always vertical and standing, especially if you already centrifuge them. Okay, once they're centrifuged, that gel, okay, is going to move between the of the amounts of blood to serum. If you were to look at a tube, okay, let's say this tube is filled with blood, all right? And 45% are red blood cells. The rest are uh, serum or plasma, depending, all right? So you are going to be using blood and you're going to be using all this blood for tests. Well, no, almost half of it are red blood cells, which we do not need. All right, we don't need that. We need the serum or the plasma. The serum or the plasma is a yellow, almost a straw colored liquid, okay, where you find all your electrolytes, all your proteins, and all these chemicals, nutrients that are in your blood, okay, and that's what the lab uses to produce lab results, okay, not so much the red blood cells. All right, so we talked a little bit about both, all right, both types of tubes they're going to be looking at. Again, anticoagulants and coagulation tubes, all right? The ones you're going to be using depending on the lab results that the physician is looking for, all right? Another very important part of it, of this chapter, is the order of draw, okay? The order of draw is very important because this is going to tell us which tube goes first, okay? Which tube goes first. The book gives you an example, okay, of an acronym, something that you use to memorize things, all right? But we're gonna talk about the order of draw, okay? In the order of draw, the very first tubes that we always collect are sterile tubes, okay? Again, sterile tubes such as blood cultures, usually the most common ones. They're little bottles that look like Tabasco sauce, okay? Usually there's two types, okay? There's anaerobic and aerobic. Again, these are covered in chapter 10 in special collections, so we'll discuss those later, all right? So the first tubes, again, sterile, sterile. You can remember the letter S for stop, stop, all right? The next tube in the order of draw would be your light blue. Again, as I mentioned earlier, your light blue tube goes first usually unless you have blood cultures, okay? So stop, light for light blue, okay? Followed after your light blue, you're gonna find your coagulation tubes, okay? Coagulation tubes or serum tubes. Again, coagulation and serum, you could try to remember them as being one and the same. Serum tubes with or without clot activators or gel, okay? If you know that tube has a clot activator, like your red top or even your orange, that's gonna go next, okay? Those tubes are going to make your blood form a clot, okay? So you want those to be next. Again, sterile, light, and then red. Red is usually the most common one that we use, okay? The red tube, remember, has no additive, but it is going to form a blood clot, okay? So remember that. The next tubes that would be next are your heparins or anticoagulant tubes. Anticoagulants that are non-EDTA, right? Such as your heparins, your oxalates, okay? Those would be next, okay? Any anticoagulant tube that is not EDTA, all right? Why? Because remember, as I said before, EDTA is the most common uh, culprit or cause for what we call crossover or contamination, okay? So we don't want to collect the EDTA tubes yet. We want them to be towards the end. And they usually are the last tubes, unless you have your gray tubes, right? Your gray tube is the one that contains the glycolytic agents, remember? Potassium oxalate, sodium fluoride, right? These are ones that preserve your sugar for those studies, okay? So let's go back. Stop, sterile, light blue, followed by your coagulation, in this case the red, stop, light, red, okay? Then you have your anticoagulants, such as your yellow, your SST, okay? Your serum separated tubes, which are your clotting factors, and then your plasma separated tubes, okay? Just like we have tubes that create clots, and with the gel, we also have tubes that keep the blood in its normal state, and they also have a gel. And you'll see samples of those, okay? So once again, stop, sterile, light blue, red top, okay? Serum, separated tubes, all right, or coagulation tubes with a gel or without a gel, followed by your plasma tubes or anticoagulant tubes that either or don't have a gel separator, followed by your EDTAs, okay? Or your greens, which are your heparins, okay, would be semi-last, followed by your EDTAs. Normally, we always have your lavender as your last one, okay? And of course, if you need to collect a gray tube that has sodium fluoride, that would be the very, very last one, okay? So again, maybe you wanna make your own acronym, but find a way to remember the order of draw. There will be a few questions on the order of draw in your national certification exam. So make sure that you are very knowledgeable in this order of draw. I did touch on the carryover or cross-contamination. Okay, I said that EDTA is the most common one. Okay, so again, you want to make sure that you keep EDTA towards the last. Okay, unless you have a gray, purple, or lavender is always going to be your last ones. Or EDTA, we have the pink ones also. That is EDTA. So make sure you keep those towards the end. When does crossover contamination or carryover occur? Why? When the additive in the tube touches the needle. Okay, remember you're going to be inserting the tubes into that rubber sheath, that needle, and if you have contact in there, that chemical comes in, makes contact, and either you can make contact with the patient, okay, or when you insert other tubes, all right, you're going to be carrying that chemical from the coagulations into the anticoagulation, creating erroneous results. Again, remember, we have to be very careful with the results that we provide, okay? So this is why it's very important that you remember the order of draw, okay? Blood is transferred from a syringe into ATS tubes. The order of draw presents a sequence of collection that minimizes risk for interference should carryover occur. Okay, so it's important that you keep this in mind and that you remember, right, the order of draw. Filling specimen tubes from bottom up always also helps to minimize the possible contamination, all right? It helps them to fill faster, okay? And again, it prevents that carryover. So make sure that you keep the tubes lower than the arm so they can fill from the bottom up, all right? Tissue, all right? Tissue, thromboplastin, right? When you insert the needle into an arm, okay, you're not just piercing the vein, you're also grabbing tissue, okay, or fluid, okay, from the skin, okay? We call this thromboplastin, okay? It's in the fluid, okay? When you pierce the skin, you're gonna bring in some of this fluid, okay? And then right away, it causes the blood to start that coagulation process. Okay, so you have to be careful. Okay, this coagulation process can interfere with some of the tests that are going to be performed. For example, the PT and PTT or PT-INR test. Remember, these are the tests that are done for to measure the therapeutic levels of medication. Okay, so it's really important that you remember that. Okay, all right. Microbial contamination. Microorganisms found in the skin can contaminate blood specimens, especially if you're going to collect blood cultures. But those, again, are in chapter 10 in special collections. There is a sterile procedure that we do to minimize the risk of contamination on blood cultures. So it's really, really important that you remember that. Okay, so we've covered quite a bit of ground. All right, again, Chapter 7 is critical, essential knowledge that you must keep in your mind, okay? We talked about all the equipment that we use in phlebotomy, most of the common equipment, okay? Including the needles, the syringes, right? The steps that you have to look for when you're looking at equipment, we're gonna be using it, okay? Make sure that you look for those expiration dates, that the packages are intact, right? That they're sterile. Remember, sterility cannot be guaranteed equipment is wet, sold, or open. We talked about phlebotomy chair and the safety measures that we have to take, okay, precautionary measures. We talked about the different systems that we're going to be using to collect blood specimens. We talked about the ETS system, the evacuated tube system, which includes your multi-sample needle. It includes your tube holder and of course your evacuated tubes. So those three items. We discussed the butterfly or winged infusion sets that can be used in special occasions, right? So that's another kind of equipment that we discussed. More importantly, the additives. Okay, the additives that are in the tubes, the two kinds of tubes. We have your anticoagulation tubes, and then you also your coagulation tubes. So when do you use which one? It's going to depend on the kind of test that you're going to be collecting, all right? We discussed several anticoagulation chemicals or additives that are in the tubes, okay? And then your coagulation tubes, which are a few, but also very important, okay? And ultimately, we discussed the order of draw. You must make sure that you follow this order of draw. If you don't, then you're going to contaminate, create crossover, and of course, yield incorrect results to the physicians. All right. Remember, incorrect results can yield in incorrect treatment. Incorrect treatment can yield in injury or death of a patient. So it's very, very important that you remember that. All right. If you don't, you may again cause injury to someone, and we do not want to do that. So make sure that that you keep that in mind. Always be very careful, reread orders, make sure that you review the requisitions before you walk into the patient's room. Make sure that you have all the equipment necessary so that you don't have to leave the residents or patients unattended when you are performing your work. Okay, so it's super important that you keep this in mind. Otherwise, you might have dire consequences. Okay, so if you have any questions, please send me an email, all right, or message, and we'll continue discussion in class during the hands-on clinical. Until then, I'll see you. Thank you for listening.